My name's Kathy Backus. I'm a veterinarian, a holistic veterinarian. I use ozone in my practice, and so I practice what I preach. And I wanted to find an ozone, a biological dentist is what it's called, or a dentist that uses ozone. And so there's actually a couple web pages that list the practitioners, and that's how I found out about his practice. And then I was so excited because it was close by, and I came in, and then I was thrilled to find that not only does he use ozone, but he's got a fabulous business model and very friendly, and they're efficient. So it really clicked in well. I actually have pretty good teeth, but I have bad gum recession, which is a problem, right? Because I'm barely under 50, and you think, well, I want to keep my teeth, you know? And I had actually, the traditional dentist had said, well, get a gum graft, and I had done that on a number of my teeth, which is a surgery, and it's expensive, and it's a little bit annoying, you know, to have the recovery. And it maybe helped like 10%, but it was like putting a little Band-Aid on it. It wasn't really addressing the underlying issue, which obviously was try not to grind your teeth or get a mouth guard of, you know, the true root cause. But in better tools, the ozone will actually help preserve that enamel, which is the part of your teeth that's going to keep it strong. And also, so then in that course, I have with the gum recession then some pockets, you know, that are left in the dentin on the root that are exposed, and that's the soft part of the tooth, which if you just keep chopping down the tree, right, you're going to lose it. So I was like, ooh, we got to preserve these teeth. And so that's when we put in fillings, and I have a, you know, when you put things in your mouth that are permanent implants or anything in your body, then you really want to be careful about the ingredients. And so having a biological dentist that actually is very careful about the type of substance that you use for your filling, as well as using that ozone. I mean, the ozone's the only thing, because it's a gas, that will get down into the tooth, and it'll penetrate. It'll go through biofilm, it'll get into that tooth, and it'll actually sterilize it. At the same time, it desensitizes. We didn't use any kind of local anesthetic. For me, that was the key. That's the way to actually have a preventative and good solution for, you know, something that was heading towards I would lose my teeth. Judith Schumacher is a veterinarian, and she was the one that introduced me to ozone and said, ozone, you know, if she had to pick, this is the exact quote, she said, if I was in a box and I had to pick one tool, you know, one tool that I could help, I would pick ozone. And that struck me. I was like, wow, that's pretty profound from a woman who has a lot of tools in her toolbox. And so that's how I got interested in it, and I actually used it first, got a machine and used ozone on some difficult cases. It had tremendous results, and then I was like, I got to find out about this. So the only course at that time was the human course. So I went to Frank Schellenberger's course, who teaches the ozone course. They now let veterinarians in small numbers to teaching human doctors, dentists, and that's when I was kind of launched in my ozone. And now it's probably the basis of my practice. I use it in so many ways. And what was interesting is it keeps circling back to the teeth, the mouth, that is so important in animals. It's huge with infection and gingivitis and things that you can't easily reach, and ozone is the thing, the cut through biofilm. And and get to it. So it's just beyond, there isn't anything else. It's a standard of care, I think, and it should be mandated for dentistry. And I was very excited to start using it in my practice in animals and dentistry. So then, like I said, practice what you preach, find a human dentist doing the same thing. So that's how Dr. Tanner came into my life.